Welcome to IMG Helping Hands live Instagram takeover series, guys. The goal of our show and is this live Instagram takeover is to introduce you to the people who could actually execute, or hand they can also help execute on your dreams to go into the residency program. So today we have our honorable guest, Dr. Naveed. I'm just waiting for his request, so he could be with us in just 1 or 2 minutes. Just give us one more minute. So yes, Dr. Naveed, if you are live with us, could you please send us a request so I can add you in the video? Dr. Naveed, did you get any request from my side to be in this live video? Oh yes, so finally we have sorted out. Thank you so much, Dr. Naveed, to be with us. Let me introduce you to our folks who are watching us live right now. So yes, guys, Dr. Naveed is with us. He is a psychiatry residency program director at Eastern Connecticut Health Network, and he's also the chairperson of the APPNA Society. And Dr. Naveed, your achievements from the last couple of years are incredibly great, and I really appreciate you took time out to be with us to provide the residency interview guidance. Thank you so much to be with us. How are you today?
I'm doing good. Thank you for inviting me. Can you hear me okay?
Yes, we can hear you. That's completely
Sorry,
fine.
I'm an Instagram user, so sorry for all the trouble.
That's completely fine. I know a few things are going new this time. So the reason we go live on Instagram is that so we can upload this video later on the YouTube channel, and also on Instagram it's available. So anyone can come at any time and then just see what we have had a discussion, or what are we doing right now.
Sounds
So yeah,
good.
thank you so much to be with us. So I was also introducing about our Instagram Live Takeover series. Our main motive is actually to help the people to go into the residency program and also to perform well during the residency interview season. So I would like to ask a few questions for you, if that's fine with you.
Sure, sure.
Yes. So being a program director, so what is the what one aspect you look in any residency candidate, and what one thing can make him or her stand out during the residency interview?
So, I'm still in the process of being residency program director. We have gonna apply for accreditation pretty soon, so hopefully that will go through. But I've been part of interviews as a faculty for general psychiatry and child psychiatry fellowship. I think the one thing, if you can ask me, that residency training directors look for is whether you can fit in their program, whether your vision, whether your goals align with the goals of the residency program, and how are you going to gel with the team of the residents they already have. So this is one thing, and then this can sort of, we can break it down into different subdomains when they look at it more closely.
Okay, that's great. Thank you so much. And also, if for example, these days, whenever like we get so many requests, like how to handle the behavior questions. So, what do you think any program can ask about related to the behavior stuff? And if you could just give a few examples about how what you will ask from any candidate about behavior questions.
Yeah, so I think the part of difficulty with virtual interview is you cannot really have that in-person experience that people used to have. So they really cannot judge you in a lot of ways, like your communication skills and things like that. So behavioral questions are becoming more and more. For example, one questions can be, they can give you a scenario about, where you have a conflict with a colleague or a faculty member, and how are you going to resolve that conflict. So for example, if you're taking care of a patient and you don't agree with faculty's recommendations for the management of the patient, so how are you going to resolve that conflict? So I think in those situations, because they're going to invoke some thoughts on the part of the candidates, so just take a brief pause, 2-3 seconds pause, and just think about it and take a deep breath before you jump into answer that. And I think most people can answer questions. It's just that when you sort of jump too early in the question. And then, for example, for conflict management, I think conflicts largely happens because of the misunderstanding, lack of communication, and sometimes people can view things differently. And as a trainee in those situations, we all need to be aware of that. We are all learners, and we are still learning. And we may know some things, but we may not know a lot of things. So
That's
in
true.
situations, just taking a pause, thinking about how you will approach that faculty in a way where it seems more coming from a place of learning, and then talking more about what is the perspective of faculty about that. And you can freely ask for that. I was going through this article, I read this, and and I just wanted to learn what was the rational, or what was the evidence behind the decision or recommendation that you made. And I think that's where most learning happens. So I think it's how you approach those situations, that's what matters. So always have a learner attitude.
Oh, that's great. So what I have comprehended is, for example, there could be any answer could be a great answer. Just be genuine about like what you're answering, right?
Yeah, so and have a stress on open communication, come it from point of humility and humbleness, and then and just try to establish lines of communication. And one thing that we certainly cannot do in this scenario is we cannot judge other people's intentions in wrong way. So we all always need to believe that there is that person also means well for the patient, and we just need to learn together.
Got it. Okay, that's great, Dr. Naveed. So, Dr. Naveed, if you were a residency candidate this year, so what would be your habit, or like what would be your notion in this situation of being the habitual construct?
Sorry, can you clarify that question?
Yeah, so if you were a residency candidate this year, so what would be your habit to prepare for the interview? What you have been doing from the very start of this season, like after you submitted your application? So how will you prepare for the interview?
Sure. I think that's a good question. So
Okay.
one thing we all need to know, whatever is in your application packet, for faculty or PDs, it's fair game to ask all of those questions, right?
Yes.
So that would be the first step. Know your CV, your personal statement very well. If you, unless you have lots of publications like 50 or 100, the publications that you need to be able to talk about those publications, right? Uh,
Okay.
and know a little bit more about the publications, so you can have more in-depth conversations about those publications. Second thing is, in the time when you get the interview and you actually appear in an interview, there would be a time period where you can look at the website for residency program, or the profile of a faculty, get to know them very well. So when you go there, you are prepared well for the interview. So that would be the second thing I think I would suggest that people will focus on. Third thing is, just prepare well. Do mock interviews with people so they can pick certain things on you. So picks, certain things that you might be doing wrong and how can you improve that. But at the same time, when you are appearing in the interview, don't give scripted answers. So think in the moment and think, what question is being asked to you, and then answer that questions accordingly. One thing that I think as an IMGs, we all struggle with is imposter syndrome, whether we are good enough. So if you get an interview from a program, they are looking at you as a potential resident. They see a potential in you being there in the future. So whatever your USMLE scores are there, your whatever is on your ERA's CV, that is in available as secondary. They will ask questions about that. So if you are able to talk about that with authenticity, that would help. And one thing that we really need to be, mindful in interview scenarios are we need to be transparent, honest, and authentic. Don't try to make up things. You guys already have worked hard. You have done enough. So you don't need to do something really extra to stand out, And then I think on the interview day, just make sure that, don't have problems like me. Like if they are gonna do Zoom, go practice on Zoom, go on Zoom, and log in early and see, if you can sort of play around with the Zoom, and then log in roughly about 15 minutes prior to the interview. In the interview process, I think that can be a whole different talk too. On the interview day, just be sure that you're present in the moment, right? Yeah. So you're not distracted by the technology around you. You don't have a lot of browser in front of you open. So don't appear distracted by the technology, by other external stimuli. Focus on the interview and what questions are being asked to you. So I think, that's is sort of summary, and I can elaborate more once we have more questions.
Okay, that sounds great. Thank you so much. Yeah, it was very elaborative. So yeah, for example, we also got a question from one of our candidates. He said that, what if I have a red flag? Like, what if I have a failure in any step exam, but still I got an invite? But now in this situation.
So Zen, your voice dropped. Can you hear me? Sorry, I couldn't hear you. I can hear you.
Yes, I can hear you too. Sorry.
Okay, so I couldn't hear your question. So the question was, I had a red flag. I feel
if any candidate have a red flag, like any failure in the exam or the graduation gap is too great if it's more than 5 years. So what should be the candidate's right approach to answer this type of question?
Sure. Yeah. So like I was talking earlier, they know that red flag from your application, right? They know about your USMLE step 1 failure, steps failure. They know that you have longer years since graduation, but they are still considering you for an interview. So that's a good thing, right? They are looking at you as a future resident. I think one thing that we need to do is, all of us have failures in life, right? We all of us have challenges in life. How do we take on those challenges or failures? That's what matters. So if it comes during the interview, the interviewer is not sort of making you feel bad about your failures, because they know about your failure, right? And they're still so they want to look at it. How do you approach it from the learner's perspective, right? So when you have a failure in life, how do you take that on? Failure is in a way is a feedback, and you will get so much feedback during the residency. So if I give you feedback, can you sort of sit back, think that feedback, do some self-reflection, and can work on that failure? So if it is being asked during the interview, that's how I will suggest that people sort of answer it. But at the same time, don't try to be defensive and make excuses. I mean, all of us have failures, so it's okay. And if they are considering you for an interview, I that's a good thing, despite your issues.
Okay, got it. So So if they're providing you with an opportunity of an interview, this means that they have reviewed all your application and now they just want to meet you and want to know what's your personality is. But
Exactly. And
if you,
I tell
yeah.
people, they just want to see what is on the paper,
Mhm.
talk about it in an authentic way, right? So
Got
that's
it.
one
Okay.
thing to look at. Second thing they want to look at is whether you can communicate and whether you can have a conversation. How do you appear in that conversation, right? That's the second thing. Third thing is professionalism. And certain things about professional habits will appear on your interviews, whether you're distracted, how well, whether how are you communicating with people? Are you nice to people? Let's say if I'm PD and you um, were unprofessional to a program coordinator because she's not part of the faculty, that's a done deal. Game is
Oh,
over. So you need to be courteous, whether you appeared late for the interview,
mhm.
without having any emergency. So those are the things that they are looking for mostly in interviews.
Mhm. Got it. Okay. And so there was one more question which we received, which was that, like, for example, if you have to interview the candidates, so will you be asking the knowledge-based questions, like from the one they have already passed from in the USMLE exams? So will you be asking those type of questions too?
Yeah. So let me take a step back and
Got
talk
it.
something else, and then I think we will try to wrap that answer to that question. So
Mhm.
when it comes to American College of Graduate Medical Education, there's 6 core competencies that they want in a trainee. So we want to see if you can be trained to attain those core competencies. So one is medical knowledge, second is patient care, third
Mhm.
is communication and interpersonal skills,
Got it.
fourth,
Okay.
professionalism, fifth is practice-based learning, and then last one is system-based practice. So when we talk about the medical knowledge, it is already, in your USMLE scores, right?
Mhm.
So I know based on your USMLE scores, your medical MSP, I know about your grades. I know where you're gonna land, right?
Got
So
it. Okay.
many good programs are, they don't ask clinical questions.
Mhm.
There might be some here and there. Some programs would ask, like they will take a written exam or they will, ask a clinical question, but it's very rare. Usually, when they ask about the clinical case, they want to see how do you approach that case as a person, right?
Got it. Yeah.
How do you deal with that case or complexity of it? I think in your application there is enough in there that reflects on your medical knowledge.
Got it. Okay. So, I mean, if anyone have written something related to any personal case in their ERA CV, so they should be prepared at least for those scenarios, right?
Yeah, yeah, yeah.
Got it.
So because they're going to ask about it, or they may not ask about what you wrote in your personal statement. They will ask you, can you describe a case that really excites you? I like to ask a question. Can you talk about a patient population that really excites you? So
Oh, wow.
for
Okay.
psychiatry, whether it's schizophrenia, that patients with schizophrenia, patients with developmental disabilities, that excites you.
Got
So
it.
it's about how you approach those patients.
Oh, got it. So yeah, so a very great question came into my mind because of you mentioned about the mental like disabilities. Like as you know, ADHD is also one of the mental disability considered in the US. And for the USMLE exams, all the candidates they can request extra time to solve the blocks for if they are having any mental disability like ADHD or autism spectrum disorder. So what's do the interview season in the interview season, do you guys also provide this opportunity if anyone have this type of like mental disability, or do you accommodate for that or not?
Yeah, so I think we should, because it's according to American Disabilities Act, we cannot discriminate based on mental health illnesses. I think, and maybe I should not say it, but psychiatrist, and I would approach things differently than someone who might not be a psychiatrist. So mental health illnesses, um, there is still quite a bit stigma about mental health illnesses, right? So yeah, I may approach it differently, but another person may approach it differently, right?
Okay.
So I think should be really careful about this. I'm not saying that you should not ask for it.
Mhm.
Certainly, ask for it if you feel like you need to ask. But also talk to your mentors first. See if you
Okay.
want to. For example, I met this really nice guy for mock interviews. That was a couple of years ago. He was
Mhm.
applying for pathology, and he would stutter when he would get really anxious. So he told me ahead of the time. I said, "Okay, that's not a problem." So
Got it.
do understand, but at the same time, I think we are not as open as a society to mental health illnesses as we can be. So just talk.
Mhm. Got it. Okay. So yeah, it depends on the individual's approach. That's
Yeah,
absolutely
yeah.
okay.
I just don't want people to be, assessed negatively because of the unconscious
Yeah,
bias.
that's true. Yep, that's true. So, for example, if any residency program have a notion about like there could be a few difficult questions which they can ask from from the residency candidates. So, what do you think can be a difficult question?
So I think, the purpose of the residency interview is not to push you or tease you or, make you feel uncomfortable. Mostly, I think people is so. I think when American medical graduates, their interviews, this is part of their culture, and they have been sort of, trained, and they're well aware of those questions and how to navigate through those situations. For us, it's a new culture, new language, so we feel anxious about things that would become easy to American medical graduates. So far, I think people are really anxious about behavioral questions that are being asked. I think that is something that can sway in either way. Then second thing that I see is talking about your failures and challenges, right? Because no one wants to talk about that. No one wants to talk about their deficiencies. But we also need to remember earlier that um, that deficiencies or failures are part of life, and they happen all the time. And then last thing, just to wrap up the answer on your questions, I don't think there are really difficult questions, because that's not the intent of it. So just take it easy, take a deep breath, and just try to have a conversation where you can be transparent and you can be authentic in that during that interaction.
Oh, got it. Okay, that's great. So, for example, if a like a residency candidate has applied to psychiatry as well, and also to the internal medicine and family medicine as well. So I know it could, well, like when you review the application, you will be able to know that if he or she has applied to any other specialty. So what will be your approach? Like, will you be asking your candidates that did you apply to other residency program? And if yes, should they be honest about it, or should they be diplomatic?
So I think when you're in, let me answer it from psychiatry perspective, because in psychiatry, one thing that we'll look for is your commitment to the field,
Got
right?
it. Okay.
And in psychiatry, it becomes more important if you have longer years since graduation, because
Mhm.
in old days, couple of years ago, it was frequently used as a backup specialty. So I would not ask you if you have applied for any other specialty. I would be able to probably pick it from your resume. So
Got
if you have done, let's say, if you have a year of clinical experience, and if you have done, let's say, 3 or 4 months in psychiatry, 3 or 4 months in internal medicine, cardiology, and all of that in different specialty, that's my way of knowing that you're interested in other specialties too, because you are sort of preparing for both specialties.
it. Got it.
We'll ask I will ask, if you are interested in psychiatry, then how come, not in the same language tone, but how come you're applying for clinical experiences in other specialties? So I think you should be able to answer that question, and
Mm,
in a
great.
very good way. I would not sort of try to deflect that question. I would not try to sort of, be diplomatic about it.
Okay.
Don't say that I'm interested in both specialties at all. Because
Okay.
what happens is for American medical graduates, they usually apply in specialty that is of their interest, right? So that's how PDs are, reviewing or looking at your application and evaluating you. So usually people don't apply for two specialties at one time. So you should have a good answer if that is the case.
Got it. Okay. So yeah, we should have a prepared, well rehearsed, or well, uh, we on like specific perspective that if we apply to this to two specialties, then why did we do, right?
Yeah, exactly.
Right. Okay. So I guess let's take questions from audience. So here is Ravik, if I'm not wrong, Sagra. He's asking, is it possible to match without observership or electives?
So I think it is possible if you are a younger graduate. If you graduated, within last 6 months, I would understand that you're not going to have observerships or externships or electives, and especially with visa issues, it becomes more difficult. But you know, even after you graduated, you can still gain some clinical experience back home, right?
Yeah.
So so there should be some clinical experience. If you're a younger graduate, it's okay. But if you have, let's say, more than 6 months since graduation, and you don't have any sort of clinical experience, I think that will not help your application. So try to find something. Try to be clinically active,
Hmm.
even when you are taking USMLE exams. And you know, American medical graduates, they take those exams during the med school, and with step one being pass and fail. Uh,
Hmm.
I don't think there is a reason to spend too much time since graduation. So um, there should be something more, um, clinical stuff that people have done.
Okay. Yeah, that's good. That's great. Yeah. So let's, I guess, take the next question, which is, do home country LOR help in interview?
So I think, if you have done, let's say, a residency back home, right? If you have done FCPS in medicine or whatever would be equivalent in other countries, if you have done that, I want to, as a PD, let's say if you have done FCPS psychiatry from Pakistan and you have been in that training environment, I want to look at that LOR and see,
Hmm.
I want to see what your um, supervisor has to say about you. In other situations, I think I would suggest people using US LORs. Um, uh, and unless you don't have enough US LORs, then you can definitely go for a LOR from your home country.
Got it. Okay. So yeah, but basically, guys, we should prefer the US LORs over the home country LORs. Got it. Okay. So I guess the next question we have is, why do you want to join our program?
Uh, I think this should be. Um, I don't know. I think you need to look at the individual program, and that's where, while you're preparing for interviews, you can look at the website. You can see what about the program excites you, what about the faculty excites you, what are different research opportunities, leadership opportunities. So look at them, and also, sometimes programs have very bland websites. They don't have much on them, right? It looks all similar. So that's where you can be more present and ask more questions during the orientation process, on the day of the interview. Ask more questions and see if you can find anything that would excite you about the programs. But I think that this varies from program to program. So try to find those things and see if you can answer that question in that way.
Yeah, that's good. And also, if your goal aligns with your program, I guess then that's one of the best bet.
Yeah, and then also, always read the mission statement of the program. all programs will have mission statement and goals. For example, for internal medicine candidate, a frequent question comes is whether we should talk about our fellowship experiences, right? So if a program is saying on their mission statement that their mission is to produce primary care physicians who can serve the local communities. They want people who would be in that role, not necessarily fellowship, right? So
Okay.
about the mission statements and try to understand what are they trying to say in the mission statement of the program.
Yeah, that's true. So whenever like they ask about why are you interested in our specific residency program, and I would say about you could reiterate their mission statement that these are the goals which align with my goals. So I guess this is one of the best bet. So yeah, thank you so much for this. And I guess Dr. Naveed, next question we have is how to find psychiatry observerships, externships as for a medical graduate. So I
So
know.
I think with COVID, it has been really difficult, but still there are some opportunities if your medical school is enrolled in VSLO, which is Visiting Student Learning Opportunities. You can access through them. If they're not, then you probably have to send hundreds of emails to get that spot. Um, for specific programs, I think Bronx Lebanon in New York, they offer observerships. Jamaica Hospital does that, but that's mostly for green card holders. Brookdale does that. Griffin Memorial Hospital in Norman, Oklahoma does that. Let me think about some other psychiatry residency program in Joplin does that. So just look at them, and sometimes you have to send many emails to just get one spot.
Yeah, that's true. And also, I believe like all the programs who got their accreditation recently, they also offer observerships. Like not all of them, but a few. Like I guess calling the program coordinator for their specific program is also a good idea to know if they are offering.
Correct.
So and yeah, so next question we got is when to sorry, which was the next question? If you are a US IMG, will they ask why didn't you go to the US med school?
Not really. I don't think people they really want to. You already graduated from med school, so I'm not really worried about why you went to a country abroad. But if they ask you, I think there is a value to going to another country. It really sort of nurtures you as a human being, right? So you are going to culture, you're coming out of a comfort zone, and that's something you can talk about during the interview. I was interviewing someone for family practice program, and that person was from upstate New York, went for college in Florida, then and we talked about that a little bit. Then that person in college, and I'm not talking about medical college. I'm
Mhm.
talking about when they do 4 years of undergrad. So
Mhm.
so he went to Florida from New York, and then he did a lot of abroad courses. So this brings a lot of value because it nurtures you as a human being. So if it gets asked, you openly talk about that. It's not something to be
To be worked, yeah.
ashamed about.
Okay, yeah, I guess that this is the least concern of the program. They just want to know that why you applied here and why
Yeah,
us. Yeah, that's more of a. Yeah, I guess we still have more questions, Dr. Naveed, but I know we invited you for 30 minutes and it's your precious time. So, would you take the questions like later on, or are you okay with
let's
taking?
question until I get a call from the hospital.
Oh, got it. Okay, okay, that's great. Thank you. So there is another question we got it. What are the characters of an ideal residency program for IMGs?
So I don't think the characteristics differ between IMGs versus AMGs. I think, like I was saying earlier, with Zan's your very first question, whether you can fit in with the existing residents, the resident team that is already there, right? Um, for many, there are two things that we need to remember. One is that when you join a residency program, that you are joining both as a learner and as an employee of the hospital, right? So as a learner, what I'm looking for is whether you have an attitude to learn, or
Sure.
you or whether you know, feel like you know it all and you cannot be taught, and your attendings are wrong, everyone is wrong. So whether you are able to be coached, whether you can be coached, whether you take the feedback, whether you can work on that feedback and can build on that. And then, as an employee, whether you can follow the processes of the hospital, right? So these are of the things that I would talk about.
Okay, that's great, I guess, yeah. So another question we got from Saima, which is, if you are a mom and have clinical gaps, and the reason is because you are in USA without any help taking care of the kids and studying for steps, how to justify this gap?
So I don't think, you need to justify. You can just say that I was busy in family care. And then, if you have a gap, since, your graduation, then you need to make up for that gap. You probably have to work for a year, 2 years, 3 years of clinical experience, research to make up for that gap, the lost time. So I think, you don't need to justify or make things up. You just say that I came here, I didn't have any support, had to raise kids at my own. So that's what I prioritized at that time. Now I'm willing to come back to medicine. And then, you can make up for lost time by doing clinical things.
Yeah, that's great. And also, Dr. Naveed, these days, many states are also providing the limited licenses on the basis of which we can practice as a physician under supervision before residency.
Yeah.
So I guess for the green card holders, it's a great option before starting their residency to show a clinical experience. And also it will be clinical experience under your name. You will have your own Medicare number, Medicaid number, own license number.
Yes.
Yeah, more known as extension.
You're talking about assistant physician, for example. Missouri has one.
Yes.
And there are some areas for that.
Yeah, so every state have their own name. Like Missouri is mentioning as an assistant physician, New York as limited license physician,
Yeah.
and in Arizona transitional training permit. So everyone have their own name, but it's more like, yeah, it's like an assistant physician, but they're not assistant physicians. They are like actually working as a physicians.
Yeah. So yeah. So just one thing. So they need to be supervised by a physician. So
Yes.
a lot of places, for example, I have, a friend whose wife was working in Georgia as sort of an in physician role. So that's still possible.
Okay, got it. Yeah, I guess that's also a great option for the green card holders.
Correct. Yeah.
Yeah. Next question we got is, what if a program director asks, what is your weakness?
So I think that's first we need to understand what was the intent behind that. So what's the wrong answer you can give her? You can say, I don't have any weakness, right? So every one of us has some weaknesses. So I think this is where you can talk with your mentors and see what you want to mention, but try to be authentic and honest as much as you can. I do understand sometimes you don't want to say that when I when I start getting angry, I punch walls and put holes in the wall. But all of us have weaknesses. So what they want to see is whether you are self-aware, whether you know what's going on with you, and whether you can rectify those weaknesses. So just think of things, talk with your family members, talk with your friends, and see what is one weakness that you can talk about in the interview process. And it's different for different people.
Okay, so Dr. Naveed, what do you think if any candidate bring up his strength as one of his weakness? Like they say, oh, I'm so perfect that this is sometimes I'm in trouble because of this. So what do you think about this?
I mean, I think it's okay, but PDs probably have done it hundreds of times. So
Yeah,
some
that's true.
answers are very standard, very generic. So it really doesn't excite me. Personally, when you give me a very standard, generic answer. So, some of the weaknesses that I can tell you, I'm a multitasker. I cannot say no to people, when they ask for me for something. I take too many tasks at one time. So these are very standard weaknesses that I have heard. I have said probably, one of them too. So I think just talk with your family and friends and see if they can point out something. And you can say that I'm working on it, right? So
Yep.
talk with your mentors and see if it is okay to say that.
Got it. Okay. Yeah, I guess that's great way to handle. And yeah, so there's another question we got from Saima, which is how long should be the tell me about yourself? Is it 1 minute work or less than that?
So maybe I think most people take about 2.5 minutes, 2 minutes, 3 minutes. So I think, just give sort of a summary of that and in that so you can lay seeds for future conversation. So don't drag long, but talk about few things about yourself, your professional life, what are you looking for in future. So as an interviewer, I can take your answer to that question and answer that. And if you can put some sort of a light joke in there, make people laugh a little bit, that will be an icebreaker.
Got it. Okay, so that's great. So next question we got, is it good to be overconfident or does it not come so well?
I think it's okay to be confident. It's not okay to be arrogant. I don't know, how do you define overconfident and how does that appear in the interview process? So if you are, engaged, you are having a decent conversation with me. I really don't have a way of knowing that you're overconfident, but just keep it, a humble attitude during the process.
Oh, got it. Okay. Thank you so much, Dr. Naveed. And let's take the last question, and yeah, we will be done after that. So Komal Binder, she's asked, is transitional year not an option for non-green card holders?
Uh, so, that's a double negative question. So I have to take 10 seconds to understand that. So I think that really depends on program to program. I know, I have a friend who is doing transitional year residency on a visa.
Okay. So
So
yeah, I guess Komal mistook our conversation. We were talking about transitional licenses, not the transitional year. That's different, Komal. Transitional year is different. That's in the residency, right? But transitional permits on the basis of which you guys can practice as a physician under supervision before starting residency. So both are completely different.
So it's a really good question. Is it okay to crack jokes or is it better to be safe? Um, I don't want you to become a comedian during the interview, right? But have a life conversation, and just try to take it easy.
Okay, got it. Okay. So we got 4 thumbs up and 3, uh, I'm not sure what to say to this, from Dr. Ahmed Rihan. He got a he gave a very great compliment here. Well, thank you so much, Dr. Naveed, and thank you so much for being with us. And I know you took your time out for our conversation to guide us about the residency interviews, and I really appreciate that.
My
And
pleasure. Thank you for inviting me.
oh, you're welcome, and have a great rest of the day. Thank you so much.
You too. Bye.
Bye bye.